Hi everybody. So today we started and completed module 3.4, carbohydrate storage and disorders. We talked about metabolic syndrome, how it's also known as syndrome X and prediabetes, that there are a number of different factors that can play into the development of this. This is more of a warning condition, meaning that you're at increased risk for heart disease and type 2 diabetes if you have 3 or more of these factors. The treatment is to deal with each of the individual factors and help postpone I told you I don't like the word reverse or cure, but to reduce the risk of developing disease. Hypoglycemia is low blood sugars. You can have reactive hypoglycemia, which refers to the low blood sugars that occur after eating a meal, usually within about 4 hours, or drug-induced hypoglycemia, which can occur from a drug reaction. For example, you take insulin injections or hypoglycemic medications and you don't eat. You take your medication and suddenly you run out the door because something happened and you don't eat, so you don't cover the medication and your blood sugars continue to drop. We talked about the difference between insulin and glucagon, how insulin lowers blood sugars and glucagon raises blood sugars. Insulin resistance can be part of the metabolic syndrome when cells resist the insulin that the pancreas is producing. So you can have normal blood sugars, but still be developing diabetes. Looked at the difference between type 1 and type 2 diabetes, with type 1 being a smaller percentage and type 2 being most of the cases, but we are starting to see them in children because of weight issues. The early warning signs and symptoms, what I call the polys, as well as looked at the consequences, macrovascular and microvascular complications. We had discussion questions. Please make sure you review those and looked at the case studies. Make sure your answers are including what we talked about in class. Let's see what's coming up. Your journals. Most of you have signed up for the nutrient sales pitch, so that's good. And I have your annotated bibliographies and outlines due sometime today. Then Monday we'll begin lipids, talk about the exam, which will then begin after class on Wednesday. Right, we'll have class on Wednesday, and then I'll have a Q&A, and I will send out the questions maybe around 2, and you have till noon on Sunday. No, noon on Saturday. Change that, Leanne. You have till noon on Saturday. And you have till noon on Saturday to send them back. All right? Be well.